I'm Dr. Dina. I'm a mom of 3 young boys and a pediatrician. I love sharing kids' health information.
By popular request, I'm going to discuss some of the things I'm asked most frequently from parents of newborns, starting from head to toe. First, blocked tear ducts. Everything in babies is small, of course, and the tear ducts are no exception. They easily block with debris or a discharge or even tears alone, and it causes a pussy, watery eye. This can last for months and months, in fact until 18 months or even 2 years, until the duct opens on its own. And that's the trick. Eventually it will go away by itself. The treatment? Making sure you wash away the debris using a warm compress. If you think they're at risk of infections, using an Epsom salt bath or a chamomile tea bag that's been cooled, or even spraying some breast milk in the eye can help prevent infections. The big trick is there should be no redness. So if you notice redness or swelling around the eye or fever, then this needs to be seen by your doctor. But most of them will open up by themselves without anything you need to worry about. Moving down the body, taking a look at the belly button, the cord, the umbilical cord. Everyone tells me that their baby's belly button smells. Of course it smells. Don't smell your baby's belly button. It stinks. I promise you that. It's old tissue that's been sitting around for 9 months that's trying to come off and die and go away. A little bit of discharge or a little bit of blood from the healthy part of the tissue is really normal as it heals, and it doesn't smell great. The trick for cleaning it is avoiding alcohol. Just use a soapy face cloth and squeeze the soapy water on top of the cord to clean it really gently. Moving down to the diaper area. So parents ask me all the time about their little boys' penises. If your baby is circumcised, you clean the tissue on the outside just like you would any other part of the body. It heals up within a week or 2 of circumcision, and you could clean it with soap and water, no problem. However, I'm very commonly asked what to do with an uncircumcised baby's penis. Many parents purposely push the foreskin back or concern that they can't pull the foreskin back all the way. And that can cause irritation to the foreskin and underneath the penis. It can actually cause it to get stuck forward or stuck back, and you don't want that. The penis and the vagina are self-cleaning organs. The penis cleans itself with a discharge that comes underneath the foreskin out of the penis. So really the trick is leave it forward. Pretend you know nothing lives behind the foreskin or underneath the foreskin. Leave the foreskin forward until the baby is 3 to 4 years of age, when increased testosterone will make the foreskin more easily able to be pulled back. Little girls' vaginas often have a little bit of bleeding or a little bit of discharge after birth, and this is from mom's hormones. As the estrogen goes away, the blood and the discharge will go away as well. If you notice an increased amount of discharge or an increased amount of bleeding, please see your doctor to make sure there's no infection. But this is very, very uncommon. Next, moving on to the hands and the feet. Very commonly, babies' hands and feet are purple or blue color. This is called acrocyanosis, and it's a sign of poor circulation to the extremities. Again, totally normal. Your baby is small and the blood vessels are very small. You can warm them a little bit, and that might make them a bit more pink. But again, just wait it out. As your baby's blood vessels get bigger, that will improve on its own. So don't be worried. When should you be worried? If your baby has blue to the face, the lips, or the tongue, then we worry about poor circulation to the central part of the body from poor oxygen content. Please see your doctor. This could be a sign of heart problems and poor blood circulation, which is an issue. So again, hands and feet being purple, that's okay. But central body, that's not okay. Lastly, peeling of the skin is really common after birth. Your baby's been floating around in liquid for a number of months, and therefore that top layer of skin is dry and irritated and wants to slough off. It will reveal beautiful skin underneath it. You can use greasy products like Vaseline or petroleum-free jelly or moisturizer, but truly that skin will probably come off anyway, so you could just leave it alone. And those are very common things we see in newborns and what to do about them. Want to learn more about caring for your newborn baby? Check out DrDina.ca. Are you loving these videos? Subscribe below. Check out more Dr. Dina videos.